Okay. Okay. So first, let me start with just giving a brief introduction of about what is Auricle. So here at Auricle, we have recorded classes, we have live classes, we have practical sessions, exam modules, and we also have hard copy books sent. Okay. So these are the facilities that we provide you here at Auricle. Okay, so recorded classes can be watched by you at your convenience, and it can be whenever you feel like watching the classes, then you can watch the classes at that time, right? So it is at your convenience. Okay, here you will have very flexible learning according to your time, and the videos are recorded by expert tutors, and you can have convenient revision anytime you desire. Okay. So secondly, we have live classes as well, like this one, where you have in-depth coverage of the topic, and we solve like past 10-year previous year questions that have come in your university exams, and we try to simplify those answers for you and to deliver you the concepts in very crisp and concise manner. Okay. And you can also clear your doubts as well. Okay. So we also have express exam module. This benefits the most when you have exams immediately, right? Okay, so if you have your exams in the immediate few days, then you can go through this exam module, express exam module. It will complete your entire syllabus in under 20 hours. Okay, and we'll also provide you with answer writing skills, like how to frame your answers and what are the points that you have to write your answers under. And it is this express exam module is curated especially for you by our expert educators who have the knowledge of about how to write the answers and what are the topics that have been asked frequently in your exams. Okay, we also have one-to-one doubt clearing session. Okay, in doubt clearing session, you can ask your doubts, and you can clear your doubts at that time only. Okay, we also have hard copy note set, and this hard copy note set is specially made in keeping in mind to avoid the students effort to create the notes. Okay, here like what I'm teaching, what are the contents that are provided you in recorded classes that has been included in this hard copy note set, and you can anytime purchase it to avoid note making. And we all know that we cannot go through each and every line of the textbooks. Okay, it's not possible to read each and every line. So we have made and we have curated this note set in such a way that it is very crisp and concise and provides you all the relevant information which is required in your exams. Okay, we also have question bank to practice just before your exams, because practice is a must before you appear for the exams. It covers both MCQ questions and your previous year university questions. Okay, we also have practical sessions because, as we know, we have practical for each and every subject, and practicals carry almost equal weightage as that of theory, and you cannot afford to miss this practical sessions, because practicals are also as important as theory. Okay, so here you will have in practical sessions you will have a hands-on experience with very experienced tutors who will provide you with all the viva questions and all the things that are asked in your exams, in practical exams. Okay. Okay, so if you want to subscribe us, and then you will have to go through these 4 plans: the foundation plan, advanced learning plan, complete learning plan, and ultimate MBBS plans. So these are the 4 plans that you can opt for according to your suitability. If you want it for 3 months, then you can purchase this foundation plan. If you want it for 6 months, you can purchase the advanced learning plan. And if you want for the whole year, then you can go for complete learning plan. And if you want to clear concepts right from the beginning, right from the anatomy, physiology, biochemistry, then you can opt for the ultimate MBBS plan, so that we will remain with you throughout your MBBS journey. Okay, so these are the various subscription plans at Auricle. Okay, so we'll start further with no further delay. We'll start today's topic, that is disorders of eyelids, right? Okay, so disorders of eyelids. Okay, so in disorders of eyelids, we have 7 topics. Okay, we are going to discuss about 7 topics. Okay, so the first topic we are going to discuss today is anatomy of the eyelid. Okay, now what is anatomy of the eyelid and what it is? Okay, we'll discuss this. Right. So in anatomy of eyelid, the most important question that can come in your exam is about the diagram of the upper eyelid. Okay, diagram of the upper eyelid. So you can see on the right hand side, we have the diagram of upper eyelid anatomy. Upper eyelid anatomy. It is the most important diagram that can come in an exam. And I have put this very simplified image which you can draw in your exams. Okay. So we have uh, layers of eyelid. Okay. So the first layer, so outermost layer is the skin. And the following that we have subcutaneous tissue. You can see here. Okay. In the layers part, the first is the skin. Okay. Second is subcutaneous tissue. Right. Third is orbicularis oculi muscle, which is present in the our eyeball. Okay. Fourth is tarsal plate. And the fifth there is palpebral conjunctiva. Palpebral conjunctiva. Okay, so these are the 5 layers you can see here. Okay, skin. Then we have subcutaneous tissue. It is not mentioned here. Okay, then third is the orbicularis oculi. Then you have tarsal plate. So this is the tarsal plate. This is the tarsal plate, right? This is the tarsal plate. And then we have palpebral conjunctiva. Okay, so this is the conjunctiva. Okay, so and this is the tarsal plate. You can see this is the tarsal plate. Right. So skin, subcutaneous tissue is not mentioned here. Second is, third is orbicularis oculi. Fourth is tarsal plate. And the fifth is conjunctiva. So these are the 5 layers that you have to remember. Okay. Now, what are the muscles that are attached to the upper eyelid? Okay. So the muscles that are attached are orbicularis oculi. So this is one muscle, orbicularis oculi. Okay. For blinking. So it is responsible for blinking. Second is levator palpebrae superioris. So this is levator palpebrae superioris. I am drawing it with blue color. Okay, see this. This is levator palpebrae superioris muscle. Okay, this one. So this is levator palpebrae superioris. Okay, right. So we have these three. Okay, the third muscle is molars muscle. So these are the 3 muscles. First is orbicularis oculi. Second is levator palpebrae superioris, and the third is molar muscles. And where are these 3 muscles? You can see here. The first is levator palpebrae. Sorry, the first is orbicularis oculi. I'm drawing it with blue. Okay, this is the first muscle. Second one is levator palpebrae superioris, and the third is molar muscle. Molar muscle. So these are the 3 muscles that are attached to the eyeball. Okay, so sorry, that are attached to the upper eyelid. Okay, that are attached to the upper eyelid. So these are 3 muscles. So we have discussed about muscles. We have discussed about layers. These are the layers. These are the muscles. And next, we are going to discuss about the glands. What are the glands present in uh, eyelid? Okay, so we have first meibomian glands. Meibomian glands. These are present within the tarsal plate and they secrete oil. Okay, they secrete oil because in the skin we have so much glands that the skin secretes oil. Similarly, in the upper eyelids also we have a gland known as meibomian gland which secretes oil. Okay, in upper eyelids we have meibomian glands to secrete the oils. We have Zis and Moll glands. We have Zis and we have Moll glands. Zis and Moll. Okay, Zis and Moll glands are located at the eyelid margin. Okay, you can see here, these are the eyelid margins. So these glands are situated at the eyelid margins, right? Okay, and these meibomian glands, okay, it is not mentioned over here, but these meibomian glands, okay, the diagram for these glands are separate. Okay, you don't need to remember the diagrams for the glands, but remember the layers, at least the layers in the muscles you have to remember in the diagram. Okay, so if you want to draw this diagram, I will erase all the points that I have written over here. Okay, you can make the diagram. This is a very simple diagram that I have chosen for you. Okay, this is a very simple diagram that at least you can draw in your exams. So keep in mind that if a question comes about the upper eyelid, okay, you must have to draw the diagram. Okay, because drawing diagram is must if in case of an eyelid question, because it is the most important part. Even I think that the question will ask you to draw the diagram, but even if it is not asking about drawing the diagram, then also you have to draw the diagram because our diagram is very important for eyelids, right? So we have discussed layers, we have discussed muscles, and we have discussed the glands. Okay, so there are 5 layers. We are revising it. There are 5 layers: skin, subcutaneous tissue, orbicularis oculi, tarsal plate, and palpebral conjunctiva. Right? These are the 5 layers. Okay, muscles, 3 muscles: orbicularis oculi, levator palpebrae superioris, molars muscle. 3 muscles. Okay, 3 glands: meibomian glands, Zis gland, Moll glands. 3 glands, 3 muscles, 5 layers. Remember this. This is anatomy of eyelid. Okay, anatomy of eyelid should be on your fingertip. Okay. Now, coming next, what are the functions of the eyelid? Okay. So even if you think about what is our eyelids do? Okay, what are the eyelids do? So, okay, first of all, always have in mind what is eyelids and what is eyebrows. Okay, so eyelids are this. These are eyelids. Okay, and this is eyebrows. Right? Don't confuse eyelids and eyebrows. Okay, when you're studying, you tend to forget what is eyelids and what is eyebrows. Okay, so protection means eyelids protect your eyes from debris, injuries, or excessive light. If suddenly you step out into the very sunny day, then what happens? You shrink your eyes. You shrink your eyes, and what is happening when you're shrinking your eyes? Your eyelids are covering your eyes. Okay, so eyelids protect you from excessive light. Eyelids protect you from debris. Debris means waste materials and injury. Okay, so it has a function of protection. It protects you from these three things. Okay, now spread the tear film. Your eyes are always wet. Okay, even if you whenever you touch your eyes are always wet because there's a tear film in front of your eyes. Okay, in front of the cornea, you can say. So it distributes your tears evenly across the surface of the eye during the blinking. Because if your eye is very dry, you cannot blink very smoothly. Okay, I'm blinking my eyes. That means my tear film is intact and my eyes is very watery. Okay, my eyes have sufficient tears to blink. So eyelids has a function to spread the tear film. Okay, spread the tear film. So first we have done protection, and second, spread the tear film. Third is moisture retention. Uh, it holds the moisture. Okay, it helps to maintain the moisture in the cornea by reducing evaporation. Okay, so if eyelids are there is reduced evaporation of the tears. Okay, so it helps maintain the moisture on the cornea by reducing evaporation. Okay, it also helps in removal of the debris by blinking the eyelids. The eyelids sweep away small particles and foreign substances. Okay, so for example, you're going out on a bike on a very dusty road. Okay, and what happens? Small particles or dust particles stick in your eye, and it makes your eye very irritated. Suddenly, when you open your eyes, you close your eyes in response to the dust. Okay, if you open your eyes suddenly, you will feel like the material has been gone, the dust has been gone. Where it has been gone? It has been either deposited here or either it has been deposited over here. It is deposited on the extreme margins. Okay, extreme margins of the eyelids. So our eyelids facilitate this debris removal. Okay, our eyelids facilitate this debris removal. Okay, it also prevents dry eyes. I told you dry eyes is not good. Our eyes have tear and it should be present in small amounts. So uh, it prevents dry eyes. It closes during the sleep or in response to the dryness, maintaining hydration and comfort. Okay, so our eyelids our eyes have to be wet to close our eyes or to blink or to maintain your hydration and comfort, right? So these are the five functions: protection, spreading the tear film, moisture retention, debris removal, and prevention of dry eyes. Okay, so these are five functions of the eyelids. Okay, so that was about the eyelids. About the eyelids, what are the layers of the eyelids? What are the muscles? What are the glands? What is the diagram of the upper eyelid? And what are the functions of the eyelid? That can be a question of your eyelids. Okay. Now next coming to the blepharitis. Okay. So what are the cause of blepharitis? Okay, I'll tell you what is the cause of blepharitis. So first of all, what is blepharitis? Blepharitis is the infection of the eyelid. Okay, blepharitis is the infection of the eyelid. Okay, and what are the causes of the this infection? It can be infectious. It can be infectious or it can be non-infectious, right? So if it is infectious, that means it is bacterial infection. Okay, it can be bacterial infection, and commonly it is caused by the Staphylococcus aureus or Staph aureus. We call it in short. Okay, we call it in short Staph aureus. So it is the infection of the or inflammation of the eyelid. Inflammation of the eyelids. Okay, so the definition of blepharitis is inflammation of the eyelids. And what are the causes? It can be bacterial infection, which is the most common cause of blepharitis, commonly caused by which bacteria? Staph aureus. Okay, in short, you can write it as Staph aureus. In short, it is written as Staph aureus. Okay. What are the other non-infectious causes of blepharitis? Seborrheic dermatitis, or you can simply say the dandruff. Okay, seborrheic dermatitis, rosacea. This is also a dermatologic condition, or you can have allergic reactions. So these can cause what? Blepharitis. Okay, seborrheic dermatitis, rosacea, and allergic reactions. Okay, so these are non-infectious causes. And what are the infectious causes? The most non-infectious causes, Staph aureus. What are the other factors? Meibomian gland dysfunction. If meibomian gland dysfunction means that your meibomian gland is not functioning And I've told you what is the function of meibomian gland. It secretes oils in your upper eyelid. So if it is not functioning properly, that means the gland will have excess of oil, which it is not able to excrete out. Okay, so if it has excess of oil, the oil will cause like a pimple. Okay, the oil will cause like a pimple, and it will cause infection in your eyelids. Okay, and other is poor eyelid hygiene. Poor eyelid hygiene can also cause blepharitis and meibomian gland dysfunction. Okay, so these are the causes. The most important cause is Staph aureus infection, right? The most common and most frequent cause of blepharitis is Staph aureus. The other causes can be non-infectious or other factors like meibomian gland dysfunction or poor eyelid hygiene. Okay, so you can see in this diagram what are the symptoms. Like this is a normal eye on the right hand side, and the left hand side is the blepharitis. So your eyelid will be swollen. So you can see the eyelid is swollen and reddened. Okay, since this is inflammation, it is obvious that the eyelid will be reddened, and there will be bacterial infection. Right, there will be bacterial infection, and there will be red eyes. Okay, so you can compare both the normal and the blepharitis side. You have swollen eyelid, you have bacterial infection on the eyelid, and in the conjunctiva, it appears whole red. Okay, it appears whole red. That means that means it is called red eye. Okay. So this was about the blepharitis, the causes and definition of blepharitis. Now, what are the clinical manifestations of what the clinical features? We have seen in the diagram that we have swollen eyelids, we have red eyelids, and we have itchy eyelids. Okay, we have red, swollen, and itchy eyelids. So this is the first clinical manifestation. Second is the crusting around the eyelashes. Crusting around means there's this crust formation. Okay, crust in Hindi, the crust means darar. Okay, so the crusting around eyelashes, especially upon waking. Okay, especially upon waking, what happens? Your eyes become all dry, and the secretion that was supposed to happen, it is not happening because of either meibomian gland dysfunction or any other causes. So the crusting around the eyelashes can be there, especially upon waking up in the morning. Okay, so crusting around the eyelashes. This is the second clinical manifestation. Third is burning, tearing, or a gritty sensation in the eyes. Gritty sensation means like a sensation of a small dust particle or a small rock which is continuously causing discomfort in your eyes. Okay, so that is a gritty sensation. Or second, you can feel a burning or tearing sensation in the eyes. Okay, so these can also be happen if you have blepharitis or inflammation of the upper eyelid, because upper eyelid has a function to remove these debris. Okay, to remove this debris or to remove this any rock. Otherwise, if your iris is inflamed, that means it is not doing its function properly. That means you will have a gritty sensation, you will have a burning sensation, you will have a tearing sensation in your eyes. Okay. You can also have fluctuating vision due to irregular tear film. Okay, so we have seen that the function of the eyelid is to spread the tear film. If the eyelids has been infected or inflamed, that means the tear film is not getting spread properly. And if it is not getting spread properly, that means in some places you will have tear, and in some places you will not have tear. So that is irregular tear film. Okay, so if you are having irregular tear film, that means you will have fluctuating vision. So these are the four causes: red, swollen, itchy eyelids, crusting around eyelashes, burning, gritty sensations. Fourth is fluctuating vision. Okay, so these are the four clinical manifestations that we have to remember in case of blepharitis. Okay, so this was about the blepharitis. Okay, we have seen causes, we have seen definition, we have seen clinical features, and now we are going to see the treatment of blepharitis. Okay, so what are the treatment options if you got blepharitis? Blepharitis means inflammation of the eyelids, right? Okay, so if you got inflammation of the eyelids, then you can maintain your lid hygiene. Okay, if it is due to improper upper eyelid hygiene, then you can maintain your upper eyelid hygiene by doing warm compresses. Okay, warm compresses means you have to take any hot cloth, okay, and you have to compress that hot cloth with on your eyes, okay, and gentle scrubbing with a diluted baby shampoo. Okay, so you have to gentle scrub the eyes with a diluted baby shampoo, because it is not harmful to the eyes. If you use any adult shampoo, then it is kind of harmful to the eyes. Okay, so you have to use diluted baby shampoo, and with that you have to gentle scrub the eyes, and you have to apply warm compresses. Okay, and you can also give antibiotics, topical or oral antibiotics. Topical means you have to apply the eye drops, antibiotic eye drops. Okay, so that is topical eye drops or oral antibiotics in case of bacterial infection. Okay, so like doxycycline is the one of the antibiotics used to treat to treat blepharitis, right? Or you can also give artificial tears to relieve dryness and irritation. Okay, because blepharitis causes dryness of the eyes, so you can use artificial tears in the form of eye drops to relieve the dryness and irritation. You can also give steroid drops in severe cases to reduce the inflammation. So these are the four treatment options. First of all, to maintain the lid hygiene. Most of the cases are resolved by maintaining the lid hygiene. Other than that, if it is not resolved, you can opt for antibiotics or artificial tears. And if the blepharitis is very severe, then you can opt for steroid drops. Okay, steroid drops. So these are four treatment options that you can go for blepharitis. Okay. Now coming towards the second type, second case of blepharitis, that is the squamous blepharitis. So it is a subtype of anterior blepharitis. So blepharitis is divided into two parts, anterior and posterior. Okay. So we are not discussing about types of blepharitis because it is a short question, and usually types of blepharitis is not important and just never be asked in exams, right? So we are discussing only about squamous blepharitis. So squamous blepharitis is kind of very important. Okay, in a separate short note can be asked on squamous blepharitis, and it has been asked previously also. Okay, so we are discussing about the squamous blepharitis. So it is a subtype of anterior blepharitis characterized by flaking or scaling. Now, what do you mean by flakes? Flakes means whitish or yellowish deposit. Okay, so if this is your eyes, okay, if this is your eyes and this is your what? Pupil. Okay, so if this is your eyes, then if I draw like this, okay, so these are flakes. These are yellow flakes. Similarly, white flakes are also there. Okay, so these are the yellow flakes. Yellow flakes. Okay, so these are the yellow flakes, and flaking means like flakes are some kind of what I can say. It is a small dot like structure, like this. It is like this. Okay, so these are the small, very dot like structure. Okay, so these are known as flakes or scaling at the base of the eyelashes. So you can have flaking or scaling of the at base of the eyelashes. Okay, so this can be caused in squamous blepharitis. Blepharitis means simple inflammation of the eyelid. It's a squamous variety. Squamous variety means that it is causing flaking or scaling at the base of the eyelashes, whereas in normal blepharitis, this is not the case. Okay, so what are the causes of squamous blepharitis? So the causes are, it is often associated with seborrheic dermatitis or dry skin conditions. Okay, it is often associated with seborrheic dermatitis and dry skin conditions. So we have seen in the case of blepharitis also, okay, in the case of normal blepharitis also, simple blepharitis, that non-infectious causes include seborrheic dermatitis, rosacea, okay, like this. So in squamous blepharitis is also caused mostly due to the seborrheic dermatitis or dry skin condition. Okay, it is not most common cause due to the scalp aureus, unlike that of um, simple blepharitis. Okay, what are the clinical features of squamous blepharitis? You have dry, flaky skin on the eyelid margins. Okay, dry, flaky skin on the eyelid margins of associated redness and irritation can also be there. Okay, redness and irritation can also be there. And what is the treatment option? You will have regular lid hygiene, use of lubricants, and managing underlying skin condition. So if blepharitis means inflammation in the eyelid, okay, so you have to maintain lid hygiene in any case. Okay, so you have to maintain lid hygiene. You have to use lubricants. Lubricants, if there is a dry eye, you have to use artificial tear in the form of lubricants, and managing the underlying skin conditions. Okay, so if you have very dry skin as a consequence of squamous blepharitis or as a cause of squamous blepharitis, then you have to treat the dry skin condition, and then automatically your blepharitis will get treated. Okay, so you have to treat according to the cause. So this is what is squamous blepharitis. We have discussed the definition. It is a subtype of anterior blepharitis. It is characterized by flaking or scaling. It's characterized by flaking or scaling at the base of eyelashes. Okay, flaking or scaling at the base of eyelashes. Okay, let me tell you what is the base of eyelashes. Okay, so this is my eyeball, and these are my eyelashes, right? So what is the base of the eyelash? I will tell you. So this is the base of the eyelash. Okay, right? This is the base of the eyelash. So it is over here that the flaking or scaling is seen. Okay, it is over here that the flaking and scaling is seen. And it is what are the second, what are the causes of squamous blepharitis? Several dermatitis, dry skin condition. Clinical features, similar, just like in the definition, flaking and scaling at the base of eyelashes. Okay, and there's redness and irritation of the eyeball, of the conjunctiva, you can say. Redness and irritation of the conjunctiva. Okay, what are the treatment options for regular lid hygiene in any case of blepharitis? Use of lubricants, or you can say artificial tears, or manage the underlying causes, or managing underlying skin conditions. So these are the three treatment options, and these are the four headings under which you have to write your answer, okay, of squamous blepharitis. Now, next most important topic, the hordeolum externum, or hordeolum externum. Okay, it is commonly called as stye. It is commonly called as stye. Okay, so what is the definition of stye? It is a painful localized infection or abscess involving the sebaceous glands of zis or mol at the base of the eyelashes. So at the base of the eyelashes, you have two glands, zis or mol glands. We have discussed in the eyelid anatomy. Okay, so zis or mol gland, it's a type of sebaceous gland, right? It's a type of sebaceous gland. If there is painful or localized infection, okay, if there is an infection, okay, or inflammation in the zis or mol gland, then you will have an abscess formed inside the gland. Okay, if any gland is not able to secrete its secretion, then the secretion will accumulate in the gland itself, and it will grow, and will finally look like an abscess. Okay, it will look like a swollen abscess. So hordeolum externum, it means it is a painful localized infection. It is localized. It is not delocalized, or it is not generalized, right? It is localized infection or abscess involving sebaceous glands of zis or mol at the base of the eyelashes, right? What are the causes? First of all, causes most often caused by Staph aureus. Again, Staph aureus is the most common cause of staph. Okay. Second is poor lid hygiene. Again, the same cause as we saw in the blepharitis part. Okay, poor lid hygiene. Third, touching eyes with unclean hands. Okay, touching eyes. If you touch your eyes with unclean hands, then you are introducing bacteria into the eyelid glands. Okay, that's why it is asked not to rub your eyes with your hands, because your hands are always dirty. You touch so many things with your hands, right? So if you rub your eyes, or you rub your hands against your eyes, okay, then the bacteria will go into the eyelid glands. Okay, then it will cause staph. Fourth is chronic blepharitis. Chronic blepharitis can also lead to staph formation, right? Or other stress or hormonal changes. This is a very rare factors, but can cause staph anytime. So stress and hormonal changes means these factors can weaken the immune system, increasing the risk of infection. Okay. So these are the 5 causes of staph. Okay, bacterial infection, poor eyelid hygiene, touching eyes with unclean hands, chronic blepharitis, and stress or hormonal changes. So these are the 5 causes of staph. So what are the clinical features of staph? Okay, so clinical features of staph includes acute onset of pain, redness, and swelling on the eyelid margins. Okay, so you will have pain, redness, and swelling on the eyelid margin, because these are also the infection happening in the base of the eyelashes. Okay, so this is also present. So because why it is happening in the base of eyelashes? Because the gland of zis and mol, it is present in the base of the eyelashes. Okay, so you will have acute onset pain, redness, and swelling on the eyelid margin. Second is tender nodule or pustule on the eyelid. Tender nodule or pustule. Okay, what is nodule? Nodule means swelling. Pustule means swelling containing the pus. Pustule means swelling containing the pus. Okay, and tender means if you press it, you will feel pain. Tender means if you press anything tender, the meaning of the word tender means if you press anything, that means it will cause pain. So tender nodule or pustule on the eyelid means that it will cause pain on touching it. Okay, or on pressing. It may be associated with a tearing or foreign body sensation. Okay, so you will feel like your eyes are secreting so much water, crying. It will give an impression of like crying. Okay, and it will also feel like you have any foreign body in your eyes. Okay, so it will give a foreign body sensation. Okay, spontaneous drainage of pus can occur. Okay, spontaneous drainage means that suddenly a pus bursts, and all the contents of the pus, it will start coming out. So spontaneous drainage of pus can occur. So these are the clinical features of the staph. Commonly seen is redness and swelling of the eyelid margin, and you can see tender nodule or pustules in the eyelid, and you will feel very tearing of the eyes and foreign body sensation in your eyes. Okay, and suddenly a pus may burst, and it can cause the overflow of the pus. Okay. Okay, so this was about the clinical features. We have discussed about the causes, definition, clinical features, and now we have to discuss about the hordeolum externum. Okay, so hordeolum externum, how do you manage this condition? So hordeolum externum is managed by warm compresses applied multiple times daily to facilitate the drainage. Okay, so we have to facilitate the drainage of the pus that has been accumulated in the glands. If we have to drain the pus, we have to apply the warm compresses multiple times in a day. Okay, we have to apply multiple times, because if you're applying any warm compresses, that means the gland is trying to open. Okay, the gland will try to open, and you can also give topical antibiotics or erythromycin ointment, which you can apply in your eyes, okay, or which you can apply over the eyelids. Okay, so these are the ointments. If infection persists, okay, so this is to be done when infection persists. Or you can also IND. IND means incision and drainage. Incision and drainage in cases of non-resolving or large styles. Okay, so these are the three treatment options that you can do for hordeolum externum. Other is oral antibiotics. It is not commonly used, but in case of recurrent or severe infections or recurrent or severe styles, then you can go for oral antibiotics, right? You can go for oral antibiotics. So this was about the hordeolum externum management. So warm compresses multiple times, topical antibiotics, example erythromycin, incision and drainage in case of non-resolving or large styles. For this, oral antibiotics in case of recurrent or severe infections. So these are the multiple treatment options that you can opt for in case of hordeolum externum, right? Okay. So coming next towards the chalazion. Okay, chalazion. Okay, let me just show you a picture of stye. Okay, so there's a difference between chalazion and stye. You can see in the stye, you have here in the base of the eyelid. In the base of the eyelid, there is swelling, right? I'm erasing it. Just see properly what it is. Okay, so the gland. So there is one gland. It is filled with pus. If you apply warm compression to it, then it will facilitate drainage of the gland, and the stye will disappear. Okay, and on the left hand side you see the image of chalazion. Okay, or chalazion. We'll study the chalazion now. Okay. Okay. Chalazion. So what is chalazion? The etiology of chalazion. Chalazion is the, okay, first of all, chalazion is the swelling. Okay, it can be different. It first has to be differentiated from the stye. Okay, I show you the diagram that what is the difference between the chalazion and the stye, right? So if you get a case of what is chalazion, so the chalazion is a slow growing. It is inflammatory lump in the tear gland of the eyelid. Okay, so it is also a inflammation of the tear gland of the eyelid. Okay, so the tear gland, the gland is responsible for producing the tears. It is inflamed. It has been inflamed, so it is causing inflammation like this. Okay, so you can see the image here. So the gland has been filled with the secretion, right? So if the gland has been filled with the secretion, it will cause swelling or redness in the eyelids. Okay. So which is the gland responsible for this producing of tear? So here the gland involved is meibomian gland. Meibomian gland. And the gland is responsible in stye was Zis and Moll gland. So these are the two things that you have to remember. You can't forget this. Chalazion is about meibomian gland. Stye is about Zis and Moll gland. Right? Okay. So what is the etiology? Blocked meibomian gland. So meibomian gland is blocked. So it is the primary cause is the blockage of the meibomian gland in the eyelid, leading to the accumulation of glandular secretions. So secretions is becoming accumulated. I told you the same is the case with the stye also. Okay. So the meibomian gland has been blocked, and it causes the accumulation of all the glandular secretions. Okay. And second is the chronic inflammation. Chronic inflammation means the retained oil causes a granulomatous inflammatory response in the surrounding tissue. Okay, so there is a chronic inflammation which can cause this chalazion. So there is associated condition like chronic blepharitis. So it can also cause stye. several dermatitis, which can cause blepharitis also, rosacea, which can cause blepharitis also, and can predispose to chalazion formation. So these three things like chronic blepharitis, severe dermatitis, rosacea, chalazion. Okay, so these are the four conditions which are interrelated. Okay, so just don't remember that chalazion causes this, sty causes this, blepharitis causes this. Okay, just remember 3 to 4 types, and you can put everything in every causes. Okay, like remember chronic blepharitis, severe dermatitis, rosacea, and sty and chalazion. Okay, you can put any causes in anywhere. Okay, so the three things are very much related because it is all the part of eyelids. It is all the disease of the eyelids. Okay, so you can put the cause in anywhere. History of styes. History of styes means recurrent styes can lead to chronic blockage and formation of a chalazion. Okay, so if there are recurrent styes, okay, this leads to chronic blockage and formation of a chalazion. So recurrent styes can form chalazion. Okay, vice versa is not true. Recurrent chalazion does not form styes, but recurrent styes can form a chalazion. So there are four types. There are four etiology of chalazion. First is blocked Mobian gland. Second is chronic inflammation. Third is third is chronic blepharitis. Fourth is severe dermatitis. Fifth is rosacea. And sixth is history of styes. So these are the various etiology or causes of chalazion. Now the clinical features of chalazion. So clinical features of chalazion includes painless lump, slow growing tumor, mild discomfort, blurry vision, cosmetic concern. So these are the five clinical features of chalazion. First is painless lump. Unlike styes are very painful. I told you styes are painful, but chalazion is non-painful. Okay, it is formed non-tender nodule. Here the term is non-tender. That means on pressing you will not feel any pain. So a formed non-tender nodule on the eyelid typically away from the lash line. Okay, it is away from the lash line, and the sty was on the lash line. Okay, it is slow growing. It develops gradually over weeks. It is not acute. Sty was acute. Mild discomfort, while usually painless, it may cause slight discomfort with the pressure on the eyelids. So it can cause pressure on the eyelids and slight discomfort on the eyelids also because it can cause irritation or redness of the eyes. Okay, so a mild discomfort can be expected from this condition, and you can also have blurry vision. Okay, blurry vision and which can lead to astigmatism or blurred vision. So the chalazion can lead to the astigmatism or blurred vision if the chalazion is large enough to press on the cornea. If the chalazion is large enough to press on the cornea, then it can cause astigmatism and blurred vision. Okay. Cosmetic concern is always there in any case of eyelid disorders. Okay. So visible swelling on the eyelid may cause aesthetic issues or like it may be very unappealing. Okay. It will not look good on you. So that is a cosmetic concern. So painless lump, slow growing, they can mild discomfort. You can experience blurry vision if it is large chalazion, and there can always be cosmetic concern, any eyelid disorder. It can be indeed in the sty also. Okay, now how do you manage this condition? First of all, the complications. What are the complications that can lead to? Sorry, what are the complications that can arise from chalazion? Okay, so if the chalazion is very infectious, it can turn into hordeolum, and visual disturbances can be there, and cosmetic concerns can be there. It is not very different from the point that we saw before. Okay, now management. Similarly, warm compresses in any eyelid disorders, steroid injections you can give for inflammation, or you can do surgical excision of the chalazion. If the chalazion is very large or very persistent for a very long time, then you can opt for surgical excision. Okay, surgical excision. We have not discussed surgical excision for sty because styes are not very big and it is usually very small. Okay, you can see in the diagram also, styes are very small, whereas chalazion is large. Okay, so the chalazion, in the case of chalazion, you can opt for surgical excision, you can opt for steroid injection, and warm compresses is for any eyelid disorder. Okay, so the next topic to discuss is entropion. Okay, so first of all, what is entropion? Entropion is the inward turning of the eyelid. Okay, I will tell you. Inward turning of the eyelids. Inward turning of the eyelids. So you can see here, see, your eyelids have been turned inward. You can see here, In the upper eyelid, that is normal. The lower eyelid has been turned towards your eyeball. Okay, so that is the inward eyelid. So what is the classification of entropy is very important. First of all, congenital, if it is present from birth, that is congenital, and entropion, involutional, that means due to the aging and laxity of tissues. Laxity means the elasticity of the tissues has been uh, gone, or it has been disappeared, because if you age, your skin becomes very flexible, your skin very becomes loose, right? Similarly, the skin of the eyelids also becomes loose and your eyelids turn inward. So that is involutional. Congenital means right presence, present from birth, or involutional means due to aging and laxity of the tissues. It can also be cicatricial. Cicatricial means due to scarring from injury. Cicatricial means scarring from injury. If there is any injury that has happened in an eye that has left any scar on the eyes, that can also cause entropy. And can be due to spasticity or muscle spasm. Okay, so there are muscles in our eyelids. I told you, levator pallidum superioris, orbitalis oculi. So if there is spasm of the muscle, it can permanently cause your eyelids to turn inward. That is spastic entropium. So four types of entropium: congenital entropium, involutional entropium, cicatricial. Sorry, my current is out. So we'll